Upper lip lines are a really common concern amongst many people who I see in clinic. When we animate, we might see, so when we're talking, kissing, smiling, we might sometimes notice lines creeping in on our top lip. They begin to bother a lot of people when they become there at rest as well, so when they become what we call static lines. And people find them very aging, and they're something that the eye is drawn to. However, equally bothersome, and maybe to me more bothersome, is when you see people walking around who've had treatment to try and correct those lines, but all we can see is this puffy and overfull white lips. So you can really sometimes see this protruded white area above the top lip when it's been treated with excessive filler. And that's, in my opinion, an even bigger problem. I think accepting a few lines and wrinkles is better than aiming for that sort of level of correction which looks unnatural. So if you have upper lip lines that are starting to bother you, what could you do about it? First up is we could look at using wrinkle relaxing injections. Now, around the mouth area, this is a very fine art and should be done by an experienced practitioner. But by relaxing the muscle a little bit and softening muscle movement, we can achieve a nice reduction in early lines, and it can certainly have a preventative effect. So if you're at the point where you can see those lines starting to form, but they're not there heavily yet, then these fine injections might be a good choice for you. If your lines are a little bit more established, then it's really important to also look at lip structure, because it's not just the muscle movement, but it's also the deflation of the lips as we age that contribute towards the formation of these lines. So looking whether those lips have changed and whether we need to add in a little bit more gentle volume again. When people are worried about having treatment with filler in the lips because they're worried about how natural it's going to look, I explain that what we're doing in this situation is we're reflating, we're not inflating. We're putting back what's been lost rather than giving someone something that they never had in the first place. So the result is very natural when it's done with that approach in mind. When it comes to treating the lines themselves, I'm a big fan of using a combination approach. So we can look at using peptides in skincare products. So a big favourite from me is the Mida Myofix Complex or the Revision Revox Line Relaxer. They're both excellent and can really help to provide a gentle wrinkle relaxing effect. Then thinking about in-clinic treatments like nanofractional radiofrequency to resurface the area or radiofrequency microneedling. They're both great choices which can help to improve the integrity of the skin, stimulate some collagen production, and reduce the depth of those wrinkles. You may also need to look at the volume of the white lip itself, which in some patients, especially those who've lost bone in the maxilla, which is the bone behind these upper gums, we might need to use a little bit of gentle volume throughout the whole white lip to recontour the area. And then when it comes to treating the lines, I always say aim for a significant improvement rather than a 100% correction. And if we're following that approach using very soft products like Juvederm Volite or Viscoderm Hydra Booster, we can get some really nice results without overinflating the lip and making it look too protruded. And the key, as I said, is don't aim for perfection. Don't aim to have nothing here, aim to have it better. And that's when you will then look your best. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.